Hello friend, it's pleasure to have you back on the channel of Clinical Care Insight. In our today's lecture, we are going to discuss about the disorder of speech. This disorder of speech will be in a series, okay? So this is the first video, and in this series we will discuss about many things regarding the speech disorders, okay? We will first start with the basic, then we will understand the classification, then how to assess the speech disorder peoples and what are the treatment ways. Fine. So let's move to the first slide. So here is the lecture outline, the today's lecture outline. First, we will discuss about the introductory part of the speech, that what is actually speech is. Then we will discuss about the speech and language, that there is a difference between the speech and language. We will see. We will also see the neuroanatomy of the speech. Remember, speech is the higher function. It's a brain function. So we will discuss about the neuroanatomy. Then we will discuss about the speech production, that once we know that which parts of our brain is involved, then we have to also understand that how speech is produced, okay? Then we will discuss about the speech error, that you might have experienced that sometimes you want to say something but unintentionally you speak something else. Fine. So this is called as the speech error, and this speech error, they have the great psychological importance, which we are going to discuss today. Then we will discuss about the classification of speech disorders, that how we can classify the speech disorder. Remember, speech disorder is a diverse group of disorders, okay? There's not a one single disease comes under this. That's why I said initially, no, we have the long journey. We will discuss long over this topic. Then we will discuss about the assessment of speech and the conclusion. So basically, this video series is in two parts. In the first part, we'll discuss about the introduction, speech and language, then neuroanatomy of the speech. Then we will discuss about the speech errors, okay, and classification. We'll basically touch the basic outline of the classification. In the next part of this video series, we will discuss about the classification in detail along with the assessment and management. Fine. So let's start. This quotation is from the Sigmund Freud. He's the father of psychology, and he did a phenomenal job in the field of psychiatry or psychology. He said that word have a magical power. Word have a magical power. They can bring either the greatest happiness or deepest despair. They can transfer knowledge from teachers to a student. Words enable the orator to sway his audience and dictate its decisions. Words are capable of arousing the strongest emotions and prompting all men's actions. So we know that sometimes someone tell us something and we easily feel motivated. But again, sometimes someone said something which is not acceptable for us, then we feel bit despair, we have bit sorrow. Fine. So words really have the magical power. Fine. By words you can heal someone, or by words you can make someone sad. So always try to speak good to the peoples. Either you can speak good or you can just shut up your mouth. That's a two way to manage your mood as well as the someone else mood. Fine. And yeah, the words and the speech, it is greatly used in the field of psychology for counseling the patient, okay, for giving the various therapies. So it have the great, the psychological importance or application. Fine. So here's the first slide. First we will understand about the introduction of disorder of speech. Remember that disorder means, see, our body's functions follow the order. Even our brain follows the order. If you provide the content to your brain in an order manner, then your brain will function in their optimal level. Fine. But if you are in a confusion, you will be speak the confused words. But if you provide the structure to your brain will function optimal. Okay, and then you have the good result in your work, in your tasks. Fine. So here the disorder of speech is basically any condition that affects a person's ability to produce the sounds that create words. Here is the two thing. First one is inability to produce the sound, or sometimes there is ability to produce a sound but we cannot formulate the proper words. We will see when we will discuss about the classification, then we will see sometimes you can say the vocalization is present, then person can produce a sound but that sound doesn't create any meaning. But that's also a pathological condition, that's also a disorder. So this definition is partially correct, I think. But you just keep in your mind that the disorder of speech is nothing. It's just a condition that affects person ability to produce the sound that create words. Clear? No problem. Now, producing a speech is a, you can say, great component in our personality. By producing speech, we can connect with the peoples. By producing the speech, we can understand the things, we can make the judgments, we can take the decision. Fine. So speech production is a very, you can say that it's a central to the human experience. They are the vital means by which peoples convey and receive knowledge, thoughts, feelings, and other internal experiences. No problem. Now we'll move to the next slide. Yeah. So before going in detail of the speech disorder, let me clear you some terms. Maybe most of you already have the clear concept about the speech and language. Fine. But here my job is to make you more understand about the, you can say, concept related with today's discussion. So just one thing you keep in your mind is that about the speech and language, remember, whatever someone speak is called a speech. Is called as speech. But when those something, okay, whatever things, if formulate in a proper structured way, or is governed the grammatical rule, then that is called as the language. So if I make a sound ah wah wah, then it is called as the speech. Okay, it might have a meaning in any other language. I know that in the English it doesn't have any meaning, but maybe this what I said have the meaning in the any other language, but it is not considered as any language. But when I say I want to eat, this I want to eat follow a proper structured fashion. It is also follow the, you can say, the grammatical rules. So this is considered as a language. It is the English language. Now, language always not need to be spoken. Sometimes it is in a form of, you can say, written. That is like writing the letter, writing the text message. So that's also a form of language. Apart from that, sometimes you don't need to write, you don't need to speak, you just show your expression, the body expression, the sign language, body language. Fine. So language have the, you can say, the three components, or you can say the three subtypes. The one is called as the verbal language, another one is called as the body language, and another one is called as the written language. Fine. So these are the three languages, but the verbal language we have to assess in order to understand the psychiatrical problem related with this speech, or you can say the speech disorder and language pathology. We have to assess the first type, that is called as the vocal type, vocal languages. Fine. No problem. Or verbal languages. So here the definition is given. The speech is defined as the process of organizing the thoughts. Okay. Organizing the thoughts, producing specific sounds that convey meaning to the listener. Okay. So here, by understanding someone's speech pattern, you can also understand their thought pattern. Now, whatever I am speaking, you might have judging me right now that, okay, the sir is telling this or that. So you have also a judgmental, you can say, capacity by hearing someone. Okay. So thoughts, you can say, the speech not only provide to understand about the person's sounds, how it speak, the melody sound or hard sound. It's also involved deeply the understanding of personality. Fine. So in the case of psychiatric diseases, the speech assessment is one of the component. We will see in a few minutes. We will see. Now coming to the language. Language is the process by which we decode the symbols. We decode the symbols that we see. Now you are seeing this. Then you can decode what it is. It is a pencil. Fine. Through the language. Now, apart from that, we can also sequence the sound, what we hear, and we can also link them to representation of word for understanding at the sensory pole, that is the Wernicke's area, and thoughts are translated into an ordered pattern of producing speech at motor pole, that is the Broca's area. Now these two terms you have the clear concept, because initially I told you that speech and language involves the higher system. It involves the brain. Fine. So when it involves the brain, it means brain have the different types, isn't it? It's have the different types. The brain is already classified. It is yet classifying. The neuroscientists are still involved in understanding the processes of the brain. Okay. So the some things are clarified. Fine. And that thing is, there are specific areas in our brain which is associated with the speech and language function. Are you getting my point? Now, one of the part is called as the Wernicke's area. Okay, another part is called as the Broca's area. Fine. Now we will discuss that what it is the Wernicke's area is and what is the Broca's area is. Fine. Let's go. Okay. So before understanding those parts, just I want to know your point of view that why do we need to study the speech? Why do we need to study the speech? You can comment. I already told you is that speech reveals the personality of a people. Okay, the way you speak, it shows what you are thinking, what you are feeling internally. Fine. Apart from that, species also help to distinguish evolutionary to one organism to the another organism. Like we do have the vocal cords. Okay, vocal cords is basically a one vocal apparatus which helps in producing the sounds. Fine. And the other organisms, take the example of the aviates, the birds, they do have the vocal cord. But you can say anatomically these two are different. Anatomically these two are different. The bird's vocal cord is not a true vocal cord, or you can say the frog vocal cord is not a true vocal cord. Fine. But as compared to those birds, as us, we do have the true vocal cord. Now the anatomical situation is also differ. Our vocal cord is situated below as compared to the birds or as compared to the other organism. Now it's reveal why we can create a specific sound and other organism can't. Are you getting my points? Apart from that, evolutionary, our brain develops bit, or you can say the slightly more as compared to the other organism. Means we have the specific brain parts in our, you can say the brain regions, which is involved in the speech and language. But other organism, they don't possess those parts. So it's also explain why other organism can't speak properly, because other organism can't formulate the word. But here is the one surprising thing, and that is in the case of birds, take the example parrot. You know that parrot can sing a song. Okay, if you pronounce certain words to them like Sitaram, 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 they can repeat your words. Why? Because in their brain they have a specific region that is called as the syntax. Syntax is basically mimicking like our brain areas, like the Broca's areas or Wernicke's areas, which is present in us. So this syntax is present in the birds, and that's why birds can, not all of the birds, but specifically talking about the parrots, then they can repeat our words. They do have a certain speech, you can say processing, a good speech processing. Fine. Now the second things why we do need to study the speech is that speech play a great role in the mental status examination. Okay, when you want to assess the patient, when you want to assess the people. Fine, not always we are assessing the patients. Most of the time we are assessing the people. Okay, for in the interview, or you can say mainly in those job which involves the good, you can say the speaking quality. So we assess these things. So mental status examination, it involves also the speech assessment. It involves the speech assessment. Now, what is the mental status examination? So mental status examination is basically a systematic and structured examination by which we can assess first person's general appearance and behavior, second psychomotor activity, third speech, fourth thought, fifth mood, perception and other phenomenon. Getting the points? No problem. Once again, yeah, through the mental status examinations, basically first thing is it's a, okay, I should write it. It's basically systematic and organized exam. Now, in this examination, what things we are assessing? We are assessing the general appearance and behavior. We do assessing the psychomotor activity, and speech is essential, as I said, because it's false. It's a third variable in the mental status examination. Got it? Then we also assess the thoughts, we assess the mood, we assess the perception and the other phenomena like the other cognitive processes. Okay, so it's as I asked, why we need to study the speech. Okay, the one way to answer this question is about understanding the evolutionary link, or you can say the evolutionary development. Another thing is, through the speech assessment or through the understanding of the speech, we can perform the good mental status examination. Okay. Now, the mental status examination, if you're talking about the indication, then most of the time it is used to assess the assess the psyche of a patient, or you can say the mental status of a person. Got it? Or most of the time it is used to assess in the patient.